welcome everybody to the April meeting for the local Alcohol and Drug Planning Committee regular meeting. We get together monthly to feature different initiatives around alcohol and drug services, the SUD continuum, the nexus with behavioral health, and any other initiatives that our community has going. Thank you all for joining us. And I think the first order of business is to approve the meetings for March of 22. And is there any discussion regarding the meeting minutes? Hearing none, I will entertain a motion to approve the meeting minutes as written.
I'll make the motion.
We have a motion from Sarah Smith to approve the meetings. Do we have a second?
I'll second.
A second from Justin Hahn. All right. Is anyone opposed to approving the minutes today? Hearing none, then would members signify their support of approving the meeting minutes by a show of hands and by saying aye? Aye.
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 Oh, wait, Rochelle, I did speak too soon, didn't I? Do we need to do a roll call vote on that?
The show of hands should be sufficient.
Okay,
Nope.
sufficient. Okay, good. I didn't want to get my wires crossed already. So thanks, Heather. All right. And I also want to take this opportunity to introduce Jen Inman. Jen is the new division manager for behavioral health from Jackson County Health and Human Services, taking Stacy Brubaker's role. And Jen, welcome to this meeting. Did you want to say a few words? Could I put you on the spot?
You can always put me on the spot. I won't stay on it for very long. Nice to see all of you who I haven't seen for a while. Nice to meet those of you who I look forward to getting to know. I start officially on the 9th, and I expect that Stacy and I will be attending together for a while.
Well, and I got to know Jen during our county's COVID response, and Jen was amazing during that. So I appreciate everything you've done for our county and look forward to working with you here going forward. Great. Well, our presentations today, I believe we have 4, depending on how you look at it. But the first one is from Katie Lenahan and Connections for Oregon SUD Inventory and Gap Analysis. Katie, thanks for being here today, and the floor is yours.
Great, thank you so much. Hi, everyone. My name is Katie Lenahan. I work at the OHSU PSU School of Public Health. I am working with Dr. Elizabeth Waddell, who is a researcher here. And we're also working with Oregon Health Authority and the Oregon Alcohol and Drug Policy Commission on an inventory and gap analysis of resources for people with substance use disorders across the continuum of care. This inventory and gap analysis is going to be done at a county level. And so the goal is really to be able to quantify both the need for services as well as the number of existing services that exist, and then to really show where the gaps exist within each county with a real focus on health equity. So not just showing where the gaps in services exist by the numbers, but also by access or by culturally relevant or linguistically relevant services. So we are trucking along with this process. We have 4 student workers who are conducting surveys with organizations that provide prevention, treatment, or recovery services to really learn more about the types and levels of services that are provided, the capacity for services, as well as different support structures that exist within organizations for clients. The way in which these surveys are being done is by organization, but the way the data will be analyzed will not ever identify individual organizations. So in no way are we ever, we're not analyzing data on individual organizations or reporting back on individual organizations, but really look at what's happening at a county or region level so we can help demonstrate the counties and regions with some of the biggest gaps in services across Oregon. As you can imagine, one of the big challenges is really getting in contact with the right people at each of these organizations so we can make sure that we're getting everybody's input and information included in the work that we're doing. So I am here today to really spread the word and to hopefully get some of that contact information about who from the organizations that you either work for or are connected with so that we can get in touch with some of those folks. I know, looking at your titles and organizations, some of your organizations we have talked with already. So thank you. If you're one of the people who have talked to one of my student workers, thank you for doing that. I will put in the chat a link to a very, very short form that would just help identify the name and email address or phone number of who we can contact to get the right info from your organization. I will also put my email in there because I'm always happy to talk to people or answer questions. And I'll also pause here as well and answer any questions anyone has about the project or the process or what we're hoping to do. I will say the goal is to wrap up the phone calls and surveys with organizations by the end of June and to have the final report analysis done by the end of August with our final report by the end of September. I'm going to go ahead and put these things in the chat, but if people have questions for me, please feel free to send those my way.
Do folks have questions for Katie initially here?
I was just wondering, Katie, how this connects to SPI, like the Strategic Planning Initiative and the evaluation of gaps and deficiencies there.
You mean like Oregon or the ADPC strategic plan?
No.
I could actually jump in, Julia.
There she is.
Denise.
There's Denise. Thank you. Yep.
Hi, Katie. I'm Denise Hacker I'm the Strategic Planning Manager for the Strategic Planning Initiative that OHA has funded. And you and I actually had a meeting last month where you briefed me on your research project. And Katie and I have been in touch. I've been sharing some of the data that Jackson County has shared that's relevant to the inventory so that we could streamline the process of information that she'll be asking for. Also, I'll be sharing the final needs assessment report with Katie as well. So she'll have that information too. And I also shared JCC's service directory that came out last month with Katie too. So I'm passing along all this information that you've been delivering to me so that Katie could have that to add to her inventory.
Yeah, Denise, and I'm glad you're here. And I did actually mean to say that in my general overview is that we really feel like the two different projects are complementing each other, where a lot of the other work that is happening is a lot of qualitative focus groups, which we don't have capacity for. And our analysis is much more quantitative analysis. So it really does, I think, help to complement the work. And I also want to recognize, I understand people are stretched super thin these days. And so recognize that there's been a lot of similar asks out there. We're really working hard not to duplicate asks and ask for information that we can get elsewhere. So thank you for that question.
So just to be clear, so there's Strategic Planning Initiative that has collected that information, but they plan on getting you the information that they've collected. And this is not similar to the ADPC. Am I saying it right? ADP.
BAR, the strategic plan for Oregon.
Right.
Okay.
Right. That kind of governs the LADPCs, right?
Lori, please. Yeah, by all means.
I think that the work that OHSU and Katie are doing is for the ADPC.
Yes.
Okay.
Yeah. Thank you, Lori. Yeah. So we are working directly with the ADPC. And this is really the first step of that strategic plan, is to really map out what is happening county by county. We will be using all the information Denise shared with us. And then the information we'll be asking organizations is to fill the gaps in information that we really still need to create the estimates, both of need and compared to what our recommended number of services would be county by county.
Okay, so Julia, I think you do bring up a really good point though. And there's like a few different things that get brought up. I mean, there was still the chip in the chaw, which had identified behavioral health as one of the primary needs and created a strategic vision around. There's the work that Denise's group is doing. Katie's group has some work. I still like this. I don't tell my kids that I printed this out because it's really, I can't read on screen, but it's this really thick document that tries to create a vision for how Oregon could have moved forward systematically from 2020. I believe it was given to the governor to potentially approve like 2 weeks before COVID. So it kind of got moved aside. But the idea that there's all these different initiatives, if there was a way just to kind of conceptualize them for people like me who are kind of on the periphery, I think that would really help in terms of how they're all kind of pulling together. because there's so much good info. I really enjoy particularly the part where it talks about like administrative accountability and tracking data. And I think, Katie, you might be taking a step towards that within this plan, even if it wasn't formally funded and adopted. But finding that kind of easy to understand, like if Eric can understand it, type of block colors and grants and like that, like where the money goes and how it all works, that would be great, because we have an opportunity here to make these things really move forward in a way that we can all understand. So excellent, Katie. And so I think, Rochelle, we can probably send out part of this request if you have a more formal way, Katie, of honestly putting in like a 1 page of what it is and what your contact is and what people might be asked to do if they respond or when they respond. How about that?
Yeah, absolutely. I will say we've had really great response from Jackson County. It's one of the counties we have some of the best response to. So just a thank you already to you all. I think a lot of people have already talked with us. And then I can send out an overview. The ideal situation would be about a 20-minute conversation with one of our student workers. We do also have an external facing survey that we can send to you. If that's a more convenient way for you to get us the information, we're happy to send it that way. I think it's just a little bit easier to make sure that the information is really accurately being entered when we have our student workers conducting the interviews, but certainly understand and can get it to you a different way as well.
All right. That sounds good. And it feels like it segues nicely, Katie, into Denise and Jeremy's presentation regarding the strategic planning initiative and the update you guys have.
So today I have the needs assessment report findings to share with the LADPC. This report was generated by Comagine Health, and Stephanie is on the call today to answer any questions that arise once I go through the Comagine's presentation. So I'm going to go ahead and share my screen and jump right into this. I'm going to go through the needs assessment findings and then move into a slide that's kind of showing how Jackson County is already addressing many of the needs that were identified. And that's something I'd like to preface to say, because I think it's really remarkable how quickly Jackson County moves. I think everyone was aware of what the needs were already, and so much work has been happening. So in doing this assessment of direct service providers and service users, we were able to collect feedback on where folks were finding some challenges that they felt needed to be addressed or bridged. But at the same time, simultaneously, all this excellent work has been happening across Jackson that is working to address these gaps. So I do want to frame today's conversation by saying that. Okay, so this report was developed by Aaron Stack and Karen Drill of Comagine Health, and it's basically an analysis of the quantitative and qualitative interviews and surveys conducted through the month of February and March. And the purpose is to share the key findings of the interviews with you all and discuss your feedback on the needs assessment report and process, and kind of collect some thoughts on where you feel priorities for next steps and actions would lie based on the findings. Just a review of how we conducted the process. Myself and Jeremy collaborated with all of you to recruit participants, so thank you so much. We completed 18 interviews with approximately 55 participants and collected 101 surveys from folks across sectors, including law enforcement, jail, probation, EMS, detox, housing, mental health, SED treatment, harm reduction, peer support, and people with lived experience. And at the end, we'd like to collect some reactions and thoughts to the data and some of your recommendations based on what this report shows. These are the areas we heard about from participants. We have kind of organized the report under resources and services, access barriers, gaps in services, needed services, and solutions. So we'll start with resources and services. And participants mentioned several substances of concern within Jackson County. As we know, fentanyl leading the list here, along with heroin, methamphetamine, alcohol, and cannabis. In addition to substance use, participants were concerned about mental health disorders and comorbid SUD and MHD. To address concerns, participants noted that the county has many services currently available, all listed here, as you can see. And along with harm reduction, there was also Syringe Exchange was discussed in many of our interviews. Next, we'll look at some access barrier feedback we've received. Participant noted there were several barriers that discouraged people from entering or completing SUD treatment, and that included long wait lists for inpatient treatment, especially a lack of referrals and some bureaucracies. And this quote is saying, we put in a lot of effort to get them engaged, then we walk away, or the treatment agency doesn't come in to support and the person wanders off. So we have to do the same effort over and over again. And the jail staff and law enforcement officers noted that not knowing what organizations provide SUD treatment in Jackson was the biggest barrier to making referrals to treatment. Participants also reported that a lack of services that provide basic needs was a major barrier. And we know that housing was predominant there, mostly due to loss of housing stock through the fires as well. Also, there was a need for additional community support and a need for culturally specific services, specifically services available for Spanish-speaking clients. Stigma was also brought up, along with philosophical differences across sectors that impeded collaboration. There was discussion of technology barriers that were mostly surrounding COVID-19. A lack of information sharing and understanding about the services, and some personal and interpersonal barriers, including unrealistic expectations, a lack of time management, fear income, and a lack of social support. Now we'll take a look at the gaps in services. So the major gaps in services that were brought up were around connecting people post-incarceration to peer-delivered services, treatment, and integration into the community, as well as connecting folks from release from the hospital and into the community, and then from completing treatment and then getting into some stable housing. And I'll go ahead and read this quote that says, there were folks who may be in dire need of SUD treatment and they are waiting weeks. They're getting minimal care while they wait. We try to patchwork things together. In my mind, this is a safety issue, especially if there's a lot of psychosocial stuff going on. If they are homeless, if they're experiencing interpersonal violence, they've got all of these other things going on and they're trying to moderate and establish abstinence. We need to get in there quickly before they lose motivation or experience another adverse outcome. We don't have the capacity right now in the county to do that well. And another participant described the need for warm handoffs and support between agencies. And I'm saying a participant, but this bullet is was brought up by multiple participants. And this quote is a singular interviewee who shared that it is challenging when there's a motivated patient who wants to engage in some kind of treatment, and we don't have the direct access to what they're asking for. It's such an important specific moment in time. If someone is ready, willing, and engaged, it would be great to say, here is what you need, and it's right in front of you. We know there is so much relapse potential that happens between the hospital stay and trying to get to your next inpatient treatment or outpatient support. Or if you're looking for MAT or methadone, it could be hard to get people signed up for methadone while they're in the hospital. Just having that direct access is always so beneficial when we can meet the person in that moment and say, here is the path forward. Now we'll take a look at the services that were highlighted as needed. Participants noted needed services to address barriers and gaps in services, such as, we know housing is a challenge, treatment options, most notably residential, additional detox facility, expanded jail facilities and supports within jail, medical and mental health support, especially for co-occurring mental health and SUD, skills training and protocols for persons working with people with use disorders, peer recovery support specialists, collaboration between organizations and partners, information sharing and clients and potential clients and between agencies, Spanish-speaking services, and case management and more personalized supports. And solutions were also identified by participants, and some of these are actively being worked on, as we'll look on at in the next slide. There were needs for staffing and administrative support, including hiring a 24-hour on-call counselors, support more SUD treatment staff to complete assessments, offer higher income and a space for peer recovery support specialists, make peer-delivered services available in mental health clinics and probation offices, hire more community health workers and social workers, establish more mobile integrated healthcare providers to collaborate with EMS, and offer law enforcement officers more time to follow up with people who use drugs. Sector collaboration solutions included offering SUD assessments and group therapy at probation offices, expanding non-enforcement mobile teams for assessment, treatment, and rapid overdose response, and initiating law enforcement co-response with SUD or mental health professionals. And then it was also discussed the need for centralizing information sharing by creating a centralized place for people to get information and a centralized hub for communication among service sectors and between service sectors and law enforcement. And this last piece on criminal consequences, this was a unique set of participants and not a widely spread feeling throughout the needs assessment participants, but I'll defer to Komahajan, but it seems that it might have been significant enough to bring here. But some folks, like participants, had said that solutions to criminal consequences could be requiring mandates for completing treatment, including through treatment courts, and provide law enforcement with more enforcement power, including the repeal of Measure 110. So now I just want to pop over here and share this slide so we can look at all the work that Jackson is currently doing to address many of these needs that are identified. And we could see that with the burn and the pending grant funding that's coming, already in the works is a plan to increase assessments, coordinate assessments with law enforcement, and coordinate expanded referrals and capability to make referrals, expanded intensive case management, connection to peer supports, and building capacity for culturally and linguistically responsive services, which we see is happening now with Recovery Cafe. And then within the crisis response network, they are currently working on their planning for non-enforcement mobile response teams, law enforcement co-response with SUD and mental health professionals, more integrated healthcare providers to collaborate with EMS and enhance connection to mental health services. And other local work groups, such as members of the LADPC, the Naloxone work group, the MAT work groups, are addressing actions towards addressing the challenges with fentanyl use, outpatient buprenorphine induction, overdose prevention, harm reduction in naloxone, distribution training, syringe exchange, I'm just putting that on here, expanding housing capacity, and increasing public awareness and education. So the space that might be best if the county felt is true to focus the SPI strategizing on could be around actions to coordinate warm handoffs and referrals between agencies for existing and returning patients, creating awareness of county services and initiatives, enhancing interagency community pathways, which Jeremy has a great thing he's working on to share with everyone, and then staff training and team facilitation around addressing stigma and philosophical alignment. So that is the presentation. And now I'd love to hear your thoughts and feedback.
Yeah, Lori, is that your hand up?
Yeah,
Okay.
thank you.
Yeah.
Where does the navigation center come in?
In the solutions?
Mm-hmm.
So the solutions, excuse me, the solutions that were identified were just things that people just came up with. That is not part of the strategic plan. It was just added as the needs assessment because it was ideas that they had at the moment for needs that they had expressed. So the navigation center would be on part of that coordination and case management and some of those other things. And as we move from needs to strategic plan, we'll be able to draw those out, and there'll be the report will reflect those, that this is already in process or this has been identified. But so that's how that came up.
Great.
And I think, Lori, where that's falling in is would come in under the need for awareness to the across direct service providers of the Navigation Center as a resource. So we can put that under the action of enhanced communication to make sure people know.
Yeah, that kind of communication is also required for the burn, to do heavy advertising throughout the county to make everybody aware of what exists and how to access. So I don't know if you're aware of the burn level requirements too.
So a lot of the things people identified as needs and even solutions, the burn, I was sitting there going, that's measure 110. But as we're listening to that, the funding just kept getting moved and all of these other things. And so those needs and solutions are a moment in time. And at that moment in time, they were needed. And because there wasn't bird in the hand, I think is the saying, I couldn't really identify that they were going to be funded or how that was going to be or any of those things. So as time moves and we get closer to funding, hopefully the funding comes before the strategic plan is complete.
Thank you, Jeremy.
Yeah, and you're bringing up the great challenge of this project, Lori, in that its timing is not well synced with the plans for the burn. So I think the strategic planning initiative is really going to be looking to the county to tell us where you would like us, what areas you would like us to focus on in developing some low barrier, low cost actions with work groups. Because again, the findings in this needs assessment are just what the county was sharing back with us. And we'd be looking to you all to share where you feel the priority for this piece of work would be for us to complete it.
So I have some feedback. This is Marty with Oxford House, by the way. As a CRM and a PSS, and also as a person with lived experience, the frustration with all the lack of services for people presenting these issues is huge. And I think to see this is amazing because it literally hits every single thing that all of us in the field are always talking about. It's everything. So I commend you on the scope and the breadth of the work. I just want to know what's the next step? And I'm super frustrated with the Measure 110 push out. I think it's till October. I know that sucks, but this is just so amazing. And I just want to see would like to know when this is moving forward.
Thank you, Marty. I appreciate that. And I appreciate all the effort Jackson made to bring participants to the table to contribute to the needs assessment. And the next plan is in March at our leadership meeting, the SPI leadership meeting at noon, the second week of May. We'll be using that as a workshop to brainstorm where do you want us to focus our efforts? What are the low barrier, low cost spaces where we can help strategize enhancing coordination, for example, if that is a goal that you would like to work towards while we're in this holding pattern with burn funding being received, or what area you all are the feet on the ground. So the best to advise what areas you feel we can work in. And then in that space, we could start pulling people into additional meetings in May and June to start, brainstorming the actions that will go into the strategic plan.
And Marty, some of my design from the beginning of this was that looking for solutions. So how this is different than the other assessments is they're often looking for the big picture, the capacity, those $2 million solutions. I wanted to also identify solutions that can be done on a staff level, just without lots of money, maybe a simple policy or procedure change, or just more information, sharing of information, finding a hub, finding some way to fill those gaps that isn't always dollars and cents.
And some of that could be, kind of group trainings on where to refer people to, based on, if they're a mother who is seeking medication assisted treatment and knowing to send them over to Oasis, or, kind of helping people know what the different services are that are available, because that was coming up as kind of a need to know, especially for folks who aren't SUD service providers and are part of the wraparound service network. So that could be a space that might be helpful to strategize in.
I just want to thank you guys for putting this together, because this is probably one of the most realistic, actual presentations that I've seen for needs and concerns, so thank you, Denise and Jeremy, and I don't know who else helped on that, but this is very well put together, so thank you.
Thank you, Justin. And we'll be sharing out the final report. We collected some edits. The final needs assessment report will go out to everybody who participated in the needs assessment, everyone who's here on this call at the very beginning of May. CoMagine is working to finalize the final report the end of this week. So you'll all have a copy if you haven't had one yet.
Denise, thank you, and Jeremy, for sharing today. Are there plans to make this an ongoing process, or 2 years from now to pick it back up and say, okay, now where are we at? How have we done? Is this going to be a living document that could move forward and grow as our community responds?
Yeah, this will be a living document with Jackson County. This is your strategic plan, and it's yours to have. And that's an interesting question, Eric, because something that's been on my mind to ask OHA is, do they have plans? I think OHA is curious about if this is feeling like a worthwhile project to the counties, and if they would like to see it happen, they continue. If you'd like this continued support to see these actions through. So that's something I think and there'll be an evaluation when we wrap this project, end of June, beginning of July, where you could give that feedback and say if you felt this was valuable to you, or if you would like to see it, if you would like continued support to continue seeing the actions through. But this will be your strategic plan to do with as you feel is best for your community.
And Denise, not to be overly glib, but yes, Oregon Health Authority, we would love for strategic planning to be integral to the way they provide services in our community, particularly with local feedback. Like at its core, that's what I hope they aspire to. So
thank you. I'm going to say that when I meet with OHA next month, because I think they'll be glad to hear that. I think we're curious, there's curiosity on, was this a worthwhile endeavor? I know it was a frustrating one in that the timing didn't work well from the start. And there was, all pieces were in sync across multiple initiatives. But I think, once the wheels got on, it felt like a really wonderful experience working in Jackson County with you all. And I think OHA would be glad to hear you would like to continue.
And will be some continuation and coordination within subgroups of this. So like the medication assisted treatment group, which JCC has funded to help me roll that out and do some things around that. So that's one area. Sarah Smith and her Naloxone group. But yes, Eric, with a little bit of funding, it'd be great to have a centralized place where a lot of that movement can happen.
Mm-hmm.
And I just want to reiterate, it's shocking that the health authority doesn't have a strategic plan, even though one was provided. And so, I look for it. I look for their outcomes, goals, and indicators as to how they're doing. And this is a major step towards that, which would be great. But, this is a really dire problem in our community. People are really suffering, hurting, and dying. And we need that state level of support and coordination, or else we're going to continue to have people being harmed. So not to be overly dire, not to keep hammering the same nail, which I basically do every month, but thank you for your work on this, because I think it's an area that we could really benefit from.
And it's true. What you're saying is true, Eric. And I think it would be great to see Jackson funded to continue this, so that, you have the capacity, and Jeremy or whoever else you elect to have part of your community work to be able to keep the coordination going. So it's not, beginning some works that are actionable and then it stalls because there's not the capacity or funding. So I think a great piece of the strategic plan will be laying out how you want to coordinate and expand this work in the future to say, let it be funded.
Right.
Thank you.
All right.
Oh, you have a question,
Are there any
Tanya?
more? Oh, Tanya. Yeah, go ahead.
Yeah, I would just say since Jackson Josephine County, our CHA, which is our community health assessment, community health improvement plan, and then there is a strategic plan that is developed, that this would actually be integrated into that, because there's a lot of work that goes into that with a lot of partners from here, both CCOs, both counties, that I think this work could easily fit into. So instead of even funding this work and choosing to fund a CHA and CHIP, which CCOs are required, public health required, hospitals are required. There's a lot of requirements around having those plans that this fit into that. So, and that would, I think, reduce some duplication work as well. So
Does that plan, Tanya, live with Jefferson Regional Health Alliance, I ask? Is that where that plan sits as a living document that they update? And Lori, you're indicating.
Yeah,
Okay.
yeah, it really is. I mean, so how it was developed, it's like they're a neutral party. So it's not the county owns it or a CCO owns it. So they're that neutral party that then helps brings all of those players into that. We are at Jackson County Public Health hiring a CHA CHIP coordinator that works hand in hand with whomever JRH identifies. So it's really those two agencies too that help lead a lot of the effort with those three bodies of work. And COVID, of course, interrupted a lot of us being able to take that strategic plan and having an action plan for all of the different things that we as a community agreed to address, which part of that is around behavioral health and substance use disorder. So, I mean, I think the information that you brought and the feedback I can see that group using it, but I think there's an opportunity to integrate it.
That sounds good, Tanya. And I think hearing this, I think what I'll do is take the CHIP and use that as the template for the strategic plan to put these pieces where they're falling within the CHIP. And maybe that's the way to have it live. And so it is kind of one body of work. And this is expanding on the actions that were already identified in the CHIP.
Yeah, let me know if you need anything, because the
Okay.
CHIP, our internal staff did write that and do all the formatting. So let me know and
Okay.
happy to help in any way.
I could do an outline layout and run it through you to see if that looks like the right way to set it up and then move from there.
Yeah, that works.
Okay, wonderful. Thank you.
All right. Well, thank you. Thank you all so much for your work on that. And Lori, we are at the point where you get to give us a burn update every month. It seems to change a little, and you've been amazing at keeping your finger on the pulse of this elusive animal. So thank you.
Thank you. And I will not need 10 minutes. I'm only going to need a few minutes. So the review of the Jackson County applications for the Jackson County Recovery Network is scheduled for May 12th, from 9 to 1 by the subcommittee. And in that process, all of the applications will be reviewed. The subcommittee members will either recommend funding or not, and whether they're to be funded in full or partially. However, a qualification is that there are not sufficient funds to fund everyone fully, because there's $265 million to be awarded to the burns, and the requests total more than 400 million. So obviously everyone's not getting funded fully. So once that happens, then it'll be presented to the full Oversight and Accountability Council for voting. And as soon as an applicant is voted yes to receive funds, OHA will reach out, provide them with a letter of notice of intent to award. And that'll happen within 2 days at the most. And then contract negotiations begin immediately with OHA. And as soon as the contract's fully executed and all the MOUs that are required are completed, then the entity will be funded, each entity that's awarded. And so the the comment about it going out to October or later is for the full state. So we're on for review and voting pretty early. The amount to be awarded to Jackson County is about 17.5 million. There have been two different amounts presented by OHA, but that's the lower of the two. The other one was a little over 18 million. So I'm just being on the safe side and calling it 17.5. Any questions?
Lori, regarding that 17.5, do we know what the total request from Jackson County is? We only know the state request, or?
We don't. We had a number of providers who wanted to keep that confidential, what they were asking for. However, when this process is completed, everybody's applications become public information. So it will be accessible after the fact.
That makes sense. Okay. Other questions for Lori? I don't think we could have had a better ambassador or person to give us insight, because there's a lot of information floating around, and Lori, you've been at the forefront of it. So thank you. All right. Well, we are at the point of our agenda where we do Cco updates, and listed first is Jeffrey Piacitelli with AllCare. So Jeffrey.
Hey everyone, thanks Eric. It's been a while since I've been here, so it's nice to be back. You know, I don't really have any major updates. I do want to say that again, I at the risk of sounding like Debbie Downer, despite all the great work that's being done right now, we're still seeing just a deluge of substance use disorder related ED visits. It's not uncommon for us to see 25 to 30 AllCare members at the ED over any given weekend. And so I've been referring like a madman to our community partners. And, you know, what we've noticed is, even though there's a steep increase of unique member presentations, we've also identified about a dozen members who had between 30 and 60 ED visits just in Q1. And so it's obvious that the usual referral pathways are not working for this particular group of members. So we're entertaining the possibility of a pilot plan specifically to address this population. So I'm kind of working on that with my team. But the demographic of these folks who are showing up at the hospital with this level of frequency, these are primarily folks who are houseless and are without a phone. These are all, I would say, primarily alcohol-related presentations. Primarily, these folks all have an ED care guideline in the collective medical platform, so that's something that we've made sure that we've put in, and still have not had success in engaging them. Primarily, these are folks who are presenting in the overnight hours and being discharged in the overnight hours. These are folks who are presenting really nowhere else. They're not going to their PCP, they're not going to the clubhouse, they're not working with a mental health provider, they're not making use of Ready Ride services, et cetera. And these are folks who have had attempted outreach by multiple SUD providers, including peer services. So even though this is a small contingent of folks that are responsible for roughly almost 300 ED visits just in the first quarter. So we're working really hard to try to figure out a way to try to engage the population. So I just wanted to mention that to the group, just to kind of let you know some of the things that we're you know, faced with and working on. I'm sure it's not a surprise to most of you, but wanted to bring that up. So thank you for your time.
Jeffrey, I don't think that's Debbie Downer. I think that is certainly gives us all pause, and it does hurt the heart to think of these folks who are suffering, and it also gives us the opportunity to look and try and identify different resources as we have in this group. So thank you for sharing that, no matter how hard that information is to hear. And with that, Darren and Julia, we have Jackson Care Connect.
Thank you, Eric. Let's see, what I would want to highlight is that two things to get. Oh, Sarah, did you have a question for Jeffrey?
I just, as a nurse, what Jeffrey's talking about sounds really familiar. And sometimes it can be other health issues, right? Besides mental health or substance use disorder. But I just got this question on my mind, like, do people, is this group of people sort of congregating somewhere, or I don't know, I'm just trying to like conceptualize it a little bit. If there's common things, ways that they could be met. I don't know. Does that make any sense?
It does make sense, Sarah. Thank you. I don't really have an answer to that. The information that I just shared is over, over 2 counties, right? So, I mean, it's both Jackson and Josephine. So I'm not sure if they are kind of congregating somewhere. I know that, one of the questions I always ask is like, how are these folks coming into the ED? Like, where are they? How are they getting there? Where are they coming from? And it's really an even mix of emergency services, law enforcement, and self-presenting. And we see, the patterns that we see are the self-presenting happens when it's really miserable outside, right? Which is no surprise to anybody here. When the weather's bad, folks, get themselves to the ED. But aside from using emergency services at the hospital level, these folks are also making use of ambulance and law enforcement services, right? So I mean, just the volume of emergency level services, and we know that there's a cost associated with that, is really staggering. So we're really just trying to put some attention on this kind of small group to see if we can do something really different, something outside of the box. And so I'm working with my team on that now. Hopefully I'll have something to report next time to the group about it.
Well, I commend you for that. Thank you.
Thanks.
And again, bringing that up when you've got people like Sarah, Chad in the room, I think ARC is soon looking to do more of this kind of meet them where they're at outreach with really very little expectations of further service connection. And I know Tanya's group also meets people who are often disconnected, and it's the only place they feel safe to get some sort of intervention. And starting there, that seems like that might be one way to begin this work. So thank you all for sharing on that. And Julia, back to you. Sorry about that, Sarah.
Oh, no worries, no worries. And to that point, Eric, there's pre-treatment dollars, however you want to say it, pre-treatment, pre-engagement dollars that are coming from JCC to contribute to efforts like that, outreach and engagement that's not billable, based on all the work that goes into meeting folks where they're at. That takes a lot of staff time from programs that can't recoup, and kind of connects to how those services would play out with the development of the navigation center and solutions along that line, and the possibilities in store for expanded crisis response and whatnot. If we could find where they were and have an echo tracker, that would be great. So I wanted to highlight 2 things. First, Jeffrey's data made me think about the project that I think is really cool, that we're doing a data project, a data claims project that the CCOs are doing with public health to examine the disparities that exist in mental health and SUD treatment according to second language, race, ethnicity, geographic rurality, things like that. The medical advisory group had requested that information, and it really goes along with the health equity focus that we have pushed forward and really want to do full throttle. So we're excited to partner with All Care in collecting data. All Care and there was a couple other CCOs because the region was quite large. So there's a couple other CCOs. Jeffrey, do you remember, or Darren, recall the other CCOs involved?
No, I don't, Julia. I'm sorry. This is Jeffrey.
That's okay. We're the only ones that matter. It's fine. Just kidding. But anyway, so it's bigger than just us. But I think we really are trying to take steps to look at like, okay, utilization is down even though need is up, right, per narrative report and per the level of acuity that we're seeing. So what's happening, and what does that even mean for folks who are navigating the system at some type of disadvantage? And what is that disadvantage? And how can, what are the solutions to the barriers, if we can know more about them? And have we engaged them enough? Do we know how to engage them? Because, we're not experiencing the same thing. So, are we even understanding how to engage them to be able to examine the barriers? It's a whole can of worms, but it's one that we need to start diving into. So I wanted to highlight that. And then this is such an interesting collection of speakers that, have rang out LADPC, because, we start with, and now I can't remember her name, but we start with our OHSU data project that's serving the larger state strategic plan. And then, lead into a lot more of the data gathering that has been done by the, is it Comagine Health? And then, it made me pause when, I think, was it Marty who asked, like, what's next? When can we do something about this and have more of an action discussion? And that's the part that I was wanting to jump in, but I was like, it's okay. I'll get some time to talk about the summit that's coming up. But that's the part where I'm like, yeah, that's what we're trying to do with the upcoming summit on opioid overdose and harm reduction. And it's basically, the whole focus is bringing together, the leaders, change influencers, decision makers, representatives from the ground floor of these teams who are emergency first response, in regards to substance use issues, is specifically a focus, opioid overdose, and really examining, what do we all bring to the table, knowing that these are the problems and this is how things are looking, and the barriers, and what can we all offer as solutions, and just engage in a really in the weeds action planning on how we can move that forward. Sure, there are still some unknowns, right? We were hoping to have known what the burn funding is going to be. We at least know that some funding is on the horizon. Agencies, I also want to respect the fact that agencies each have their own strategic plan as well, right? So there's no entity that can really govern an agency's strategic plan. And yet there's ways in which we can come together and leverage our resources and have an action plan about this shared understanding of what the problems and the barriers and the gaps are, and what we bring to the table in that way. We're going to structure the breakout groups into kind of, those representatives of where the barriers are and who the solution makers would be, and how we can get aligned around the problem with some narrowed down, let's not try to tackle all the problems, but narrow down, what are the things that we can take action on in the immediate future. And that differs a little bit from a strategic plan in general, because a strategic plan can be very 5-year facing versus immediate action on what to do next. So, we're always interested in ways to reduce redundancy and duplication. We've already connected with Denise and Jeremy, on this project, and I would really encourage the action planning to happen in that space where we can, recognize and appreciate each agency as its own entity, but yet coming together as a bigger organization to action plan on the details of what we know so far. So this summit is on May 17th. It's going to be virtual format. It's going to be 8 a.m. to 12:45. So we recognize that we probably couldn't hold hostage, all of our said professionals for a whole day or a whole week, which is what we would prefer. So we're just keeping it to 8 to 12:45, and preparing folks as much in advance with information, that they'll have prior to, and also, during the conference, to be able to have really productive conversations. And I would encourage you to put your name and email in the chat if you have not received an invitation. Awesome. And if you would like one, we are not necessarily we're not encouraging folks to just forward it out and to have like an open invitation, because in order to have a really productive conversation, it can't be limitless participation. We have to contain it. And so we're just, so definitely put your name in the chat. Darren's on the call also, and he'll check and see who's in there that we need to get invitations to. And we might want to have more of a discussion and follow up with you about what population or piece of the problem that you would represent and bring solutions around. So any questions or additional comments? I want to emphasize, actually, before I hand it on over to Eric, I just want to emphasize this is not a JCC opioid summit. This is so JCC and All Care will be sharing our claims data, definitely, but we are just providing support in terms of the facilitation, the technological structure for the virtual meeting, and just preparing and holding it. This is a professional stakeholder, community-based owned project. It's a public health issue. This is everyone's, vested project. So I just want to highlight that in terms of ownership.
Thank you. And quickly, Julie, will there be like a report out from the summit in terms of a finalized product to share?
Two things on that. There will be, and LADPC was where I was hoping to bring that. And then we can also talk about other spaces. And then of course, the listserv of the folks in attendance. We will run the notes from the summit by that listserv first, so that we can make sure it's an accurate representation, and then we'll have that right up. And it's also going to be given to, once it's reviewed by the participants of the summit, it's going to be given to the community engagement committee that is part of the crisis response network that serves as a venue for listening sessions and feedback from folks with lived experience. And so we are going to be funding and supporting listening sessions that would be able to give feedback to that summit.
Perfect. Thank you. Yeah. Sarah, did you have a new question, or is that a hand from earlier? Okay. Gotcha. No worries. Well, thank you, Julia, and certainly look forward to the summit and the fruits of the summit. Now is probably a good time to introduce the idea too that we are down, I believe, 2 members, Rochelle, or is it 3? Just 2? Okay. And so in terms of, we have 2 vacancies. So if you know of folks who would be good, we'd love to consider them. And if you, so please encourage them. The application is on the county website. And we then consider and vote for those people who are interested in serving on this committee. So we are at that point. But local treatment provider updates, Kim Ovison is not here. So Lori, for the ARC, please.
Yes, I get to be Kim today. So we are in the process of staging the in-person return of outpatient services. And we're starting an early engagement program to support clients who are pre-contemplative, and offering daily in-person gender-specific groups with focus on barrier busting, skill development, and engagement opportunities. And our goal is to bridge the gap between first contact with treatment and other levels of care. We're opening our engagement center, planning that, staffed with CRM. So that's a drop-in engagement center. And for people who are pre-contemplative or just need a place to go to talk to someone and get resources.
That's awesome. Where is that located, Lori? Just so
it's on our East Main campus.
Okay,
and we'll
perfect.
have more notice around that when the time comes.
Okay, it's exciting.
That's been a gleam in our eyes since well before the pandemic. So yeah, so we're anxious to get that going. We've increased Detox Census to 8. As you may recall, we're limited to 10 beds at our current location, and opening up to a capacity of 10 is dependent on finding more LPNs, which are very scarce these days. We're making great progress in hiring residential staff, and our goal is to reopen ready within the next six weeks, or as soon as possible, sooner, depending on the training of the new staff. So all of that, good news, and we're on our way.
Much appreciated. Thank you for that update. Is Jody here from Medford Comprehensive Treatment Center?
I just had one thing.
Oh, go ahead. Yeah, sorry, Marty, go ahead.
Just to, regarding the ARC in general. So I started my current position in November, and so I spent a lot of time in Jackson County. And the ARC is one of the most impactful organizations on the members of on the people that live in our houses. I have there are 2 alumni I know personally that work there. One just signed his offer letter, and I am just so overwhelmed with. I just love your organization. I just wanted to commend you guys. Yeah.
Thank you.
I see the progress every day. So thank you very much.
Thank you for that.
Thank you for sharing that, Marty. That's awesome. All right. Now we'll turn it over. Is Jody here? We can see.
I am. Can you hear me?
Yeah, absolutely. Thanks, Jody.
Hello. So updates here. We have a new medical director. His name is Dr. Lauren Cross. He oversees our Salem and Albany clinic here in Oregon and also in Medford. So we're excited to have him on board. And that's pretty much it on our updates.
Awesome.
We still have same day access. People can walk in Monday through Thursday, and we'll get them admitted and start their treatment.
Good deal. All right. Moving on to Boulder Care. Justin, how are you, my friend? Good to see you.
I'm amazing. I'm seeing you all. I'm in Indianapolis right now visiting my parents, so I'm in their office. Lots of like so warm in here. No, I wish I had some great updates, but we are just trucking along as we do, and as always, appreciate all the work that you all do, and love just being here and seeing the amazing stuff. So thanks.
All right.
Justin's being modest. He presented at ASAM on the Jackson County CJTC program.
That's true.
He was one of the 3 speakers there.
That's true too. But I just smiled really big, and Jeremy was the one that was doing all the talking. So, but it was really, really awesome to be able to talk about the amazing work that we're doing there. So thanks. Thanks, Jeremy.
We'd love to hear more about that, maybe at a future meeting, in terms of what the presentation was. And never sell short, smiling big. That's probably 80% of what I try and do. So honestly. All right, Dane with HIV Alliance.
Sure, thank you. With Prime Peer, I just want to let you know we hired and fully staffed, so now we got a lead Prime Peer plus 2 actual Prime Peers, so it should be able to help a lot more people with that program. That was pretty much what Michaela had for me to update you all on that. But we're looking forward to engaging with a lot more people. I know they're working with Jackson County Health Department, showing up at Syringe Exchange, so that should really just take off. And anywhere you feel a need for our Prime Peers, we'd be happy to supply that. I just combined all the naloxone trainings for both Josephine and Jackson. We are seeing we had 32 reported overdoses for both counties, 8 in Jackson, 24 in Josephine, trained 99 people, and that was about 390 doses that we got out there. So we are other things I want to talk about is Save Lives Oregon. If nonprofits have not applied for that, you can apply for the same funding, and Naloxone is one resource there, and they'll match you up with a partner to train you. Like Max's Mission is part of that. HIV Alliance is part of that. But they are a resource. You can apply for multiple levels of harm reduction. And I would encourage agencies that would want that to reach out to Julia or myself, and we can get you the Save Lives Oregon application information. It's simple. It's just another way to get more naloxone and other harm reduction. I mean, you can order whatever you'd like, our wound care kit, supplies, syringes. There's also, and I've had one success story here in Douglas, HIDA funding for police departments. They're always looking for naloxone resources. Douglas County did apply for that, and they're funding naloxone for police departments. That's always a big gap. So any police department that's HIDA, they can apply for that funding, and I can get you that application form for that. And then the schools, Emergent has resources. They're supplying 2 doses to middle schools and high schools. So there's an application for that. They do need a medical provider to sign off on that paperwork. That's not only for schools, community colleges, and also libraries and YMCAs. I have all those forms, and I'd be happy to get them to you, Eric, if you need them. But I think that's another great resource and another great way to fund naloxone. I know schools really are wanting to get that, and we're happy to help provide that training, but they'll give 2 doses for every school. But that's pretty much my update. Some great information there, though.
And Dane, if you want to use, sometimes Rochelle and I can serve that role with this group as far as sharing that information. So Rochelle Scott also is somebody that helps get this information out. If we were all meeting in public, in person and hanging out, we'd be able to share it a little more readily. But within the Zoom context, I think we're still within our rights as a advisory board in sharing that information with the group. So
okay, I'll get it to both of you, and you can get it out to the group. But thank you very much.
Very cool. And Cynthia with Colpia.
Hey, y'all. We actually do have a little bit of an update. So we have some exciting news happening. We are in the process of joining the Options for Southern Oregon programs and services. So effective May 17th, Colpia as a private entity will end, and May 19th, we will be a program under the Options umbrella. So we're really excited for that partnership, and what that's going to do is just really allow us to have more resources and supports available to our clients. It'll be a seamless transition for clients. They will still go to the same locations. I'll still be the director of the program. They'll still call the same phone numbers, have the same staff, all of that. So it'll be pretty seamless to our clients. But we're excited to have the extra resources and support. So that's my update.
Same great Colpia, though.
Same
Yes.
great Colpia. Yeah.
Okay, very cool. All right, that's exciting to hear. So Sarah, we still have you down for La Clinica. Do you have any updates from La Clinica that you'd like to share?
I do. I have a couple. Many of you, or maybe all of you, know that there was a really ugly petroleum fire downtown where South Central meets Riverside. So our clinic fortunately wasn't burned. The place that we used to keep the operators at the care call center, that building did burn sky high. Our landmark, how to find Birch Grove, go to Sky High and go in the parking lot. Anyway, they had some damage. So we expect that we may be back in our building next week. There are just some, IT things and cleanliness things. So that's pretty exciting. We've been at other clinics who've been very hospitable, but we'd like to go home. So hopefully soon. The other thing I think it's escaping me now. Oh, no, it isn't escaping me. So we were able to sign an MOU with Max's Mission. So we should be able to put up more Nalox boxes at our clinics. We've had one at Birch Grove for quite a while. It's been a great partnership with Max's Mission. So I'm looking forward to getting more of those up around the valley, working with Julia. And Tuesday, I'll be talking to the Rogue River School District staff about naloxone. One of the things I learned putting together that presentation is that the adolescent overdoses between 2019 and 2020 went up 94% nationally. I mean, that's almost doubling in 1 year. And then it went up, I think, like 20% again into 2021. And the headline was that it's not that there are more youth using necessarily, it's that the drugs are so much more dangerous. So then there was a study in the Journal of the American Medical Association, and it showed that deaths by adolescents is driven by a 77% increase in fentanyl. So that's kind of the take home. And I think many people here who are more on the ground than I am have the experience with M30s, with blues, with what have you, and it's basically fentanyl. So it's really troubling. And I'm glad that the school district is interested in that.
Yeah, I'm glad they're starting to reach out too, Sarah. So thank you for that. And that does move us to Max's mission. And Julia, I hope Sarah didn't steal your thunder and take away from your presentation today, but.
No, we're more than happy to share the thunder.
All right.
It's that'll be exciting to have boxes outside clinics. We'll be able hopefully to go to Central Point, out to Phoenix, other areas down the road from you, Eric. So yeah, we're very excited about that, and we continue to add more boxes. So it looks like we'll be adding another one in Shady Cove. We will have a Naloxone event in Shady Cove May 12th from 11 to 2 outside the library, partnering with the library there. We know that's an area that is it's hard to get to, if you like, and there's a lot of need. Whenever we go out there, people are really welcoming. And interest today from Rogue River, from the fire department there to have a box. So it keeps on going in all 3 counties. In March, we put out about 350 kits in Jackson County alone of naloxone, and we had 66 overdose reversals reported. So our numbers have really escalated this year, and we have seen to scary levels. We're glad we can get the naloxone out there, but certainly there's a lot of overdoses happening. And I know a lot of people know that. So I think that's about it for the minute. We're starting to work on Overdose Awareness Day and putting that together, and we'll be contacting over the next month about that, many of you. But other than that, that's it, I think.
Well, thank you, Julia. Much appreciated for that update.
Thank you.
Is Kyle, I see Kyle there from Medford Treatment Center. Kyle, updates.
Yeah, hi everyone. Not a whole lot to update on here. We are working with La Clinica on getting naloxone in the hands of our clients. We're actually working on a project where we can actually physically hand it to them rather than handing prescriptions to them to eliminate some of the barriers there. So we're happy to do that. We've been working a lot with the Beckett Center lately, trying to allow some of our methadone clients to enter the Beckett Center if needed. Also, I mean, just like everybody else, we're seeing a lot of the fentanyl numbers out there are scary. So we're really doing everything we can to combat that, and trying to do what we do and integrate with our clients and provide services. That's what we're doing.
Certainly much needed. So thank you, Kyle. Mm-hmm. All right. Oasis, Kristen.
Hi. Are you guys able to hear me? Perfect.
Yeah.
Let's see, some updates from Oasis. We hired a new peer, which is really amazing. And so that's been great. And kind of what's been taking up a lot of our space has been that we're going to be relocating. And I think I shared that at the last meeting, although I'm not sure that we'll be relocating across from Hawthorne Park, hopefully by the summer. And that process is, we have permits in, and I'm working on that. So that's going to be a pretty big deal. But so far, that prenatal care is going really well. A lot of our services, we've started some new groups. We just completed a group in partnership with the Family Nurturing Center, which was great. And just thank you everybody for your updates, and thanks Denise and for presenting that. So that's all
Kristen,
I
don't know if it was well known, but it still feels a little bit like a bombshell. So a big scoop and a big move for you guys. So.
Well, it constantly kind of feels like that to me too, because I'm like, oh my gosh, like there's so many pieces to that goes into moving, but we're really excited, and it's going to be a great space, and we really look forward to showing everybody, inviting me down, and so wish us a lot of luck. And thanks to the ARC. If I didn't point this out in the last meeting, we're very grateful for the space that they provided us. So
that's great.
Thanks everybody.
Awesome. Thank you. All right. Well, Eddie with On Track.
Hey there. Hey, everybody. I don't think I have too many new updates this week. We've got the outpatient offices open in Medford and Grants Pass and Cave Junction, and the residential programs, the home program, AKA the mom's program, the dad's program, and our Mountain View facility up in Hugo. Everything's open. As always, we're still looking for great residential support staff folks. If you know anybody who's looking, we'd love to talk to them. And our On Pace program, the peer and counselor education program, I can't believe it. We're already looking for folks who are interested in the third cohort, which would start in September of this year. We're finding that our sweet spot is about 9 or 10 students per cohort in order to work out the placement for their apprenticeships and stuff like that. But it's very exciting. And the first cohort members would be testing for their KDAC later in the year, like in the fall. So we get to see what the graduates look like coming out the other end for the first time. So excited about that. As always, if you have any questions about what this training program is, please send them my way. And I'll connect you with the right information and the right folks. We're looking for folks who want to be peers and KDACs and participate in this training program, which is tuition free. That's it.
So exciting, Eddie, for it to go from a grant concept to, the first cohort to seeing them all the way.
Yeah.
Sounds crazy to say 3 though, doesn't it? That seems like
it does,
right?
Yeah. We've been holding our breath for a year. Like, is it working? Is it working? So I think we think it's working. So fingers crossed.
Very innovative. All right. Well, Marty with Oxford, welcome. And any updates?
So I have one update. It's a pretty exciting one. So I've been opening a whole bunch of houses in Southern Oregon, and we just opened a new men's house in Medford. So it's the T. Lindsay House. It's named after a gentleman who succumbed to the horrors of addiction after he was in one of our houses and sadly had to do more research. So we try to honor these people. And it's named after a gentleman named Tim Lindsay. It's called the T. Lindsay House. It is for 12 awesome, amazing men in recovery. We are, as always, we're accepting applications all the time. Go to www.oxfordvacancies.com. That's for anywhere in America. You just put in the state and the county. And I put my information in the chat. So if anybody needs to get a hold of me, give me a call. And I think I have some people that will be giving you a call soon, Eddie, about that program you were just talking about. So that's awesome.
Beautiful.
Thank you, everybody.
So cool. All right. Thank you. And Recovery Cafe, Reclaiming Lives. Stephanie's not here, but Brandon Orr.
Yes, I am here. First off, this has been really informational, LADPC, right here today. Want to give a big shout out to everybody. There's a lot of good information, a lot of positive moving forward stuff. Now about Reclaiming Lives Recovery Cafe. You guys, we have the most members right now we've ever had. We have 211 active members attending circles right now. I know that since it's springtime, thank you. Since it's springtime, this is the first spring we've actually been able to be open since COVID kind of closed everything down. And I told Stephanie, I said, get ready. The doors are about to blow open. And man, we have been hitting record numbered nights at Cafe. Marty was there one night. We had 80 people there. Last night we had about almost 70. Monday we had 70. So, we're getting about 4 or 5 new members a night, up to about 6, 7, depending on the night. So it's getting exciting. It's also getting a little overwhelming, but that's a good overwhelming. All of our classes are still going. Johnny B's killing it up there with all classes 5 days a week. He's getting anywhere. Matter of fact, he's got a class right now with about 15 people in it. So we're getting everywhere about 15 to 20 people coming every day. Drop-in still going good. All our activities we got going on to our calendar. We're still open Sunday through Friday and absolutely having a blast doing it. I can't believe I call this work. It is work, but I can't believe I get to call it work. Something really exciting is about to start tomorrow. It's going to be a soft opening for Latinx Cafe, for the Spanish-speaking cafe. We're super excited about that. Rico Gutierrez, he's going to be the manager. He's going to be doing my part on his side. I'm going to walk alongside him as we get this thing going together and get it all ramped up. So it gives me chills to think about we're able to do something like this, and that Stephanie had the mind power with this great core group of people we have in the board as well to come together and just be able to put something together for the Spanish speaking members. So many times I go to a store after I get off work and grab my sodas and chips and stuff to watch movies with the wife. And I see, you know, a Latino in there who can't speak Spanish holding 3 cases of beer. And I just want to hand him my card and he doesn't understand what I'm saying. So this is groundbreaking for us. I want to give a big shout out to the Max's missionaries. That's what I'm calling them now, because I see them everywhere out there filling up them boxes. They're filling up our boxes probably once a day. So that's been really, really good. The Max's missionaries. I just came up with that. Pretty cool, huh? With that being said, we like to talk about a member always in these forums, but right now I want to talk about a bunch of members. We have now started a Recovery Cafe softball team for the board members, for volunteers, and our members that are attending their circles. It's been a beautiful thing to watch you guys come together. You know, not a lot of them know how to play, but that's not the point, right? The point is for them to get out there and do something they've never done before. It's been a pleasure watching these smiles happening. And at the end of the day, when they're saying thank you to us, when really we should be giving them the thank yous. So we're moving along nicely here. We're not afraid of any hurdle we have to jump, and we're just super excited to move forward. And I'm so glad that everything's opening up and people are starting to move forward so we can get more treatment out there, more help to these members and people in our community. And I'm just super blessed to be here today. Thank you guys. And if you have any questions, you guys know where to find me.
That's inspiring, man. That's inspiring. And plus your team's going to have a great cheerleader in you, Brandon, because I know you're retired from the sport.
Bro.
He's not. He's a very good
I've been
pitcher, and he
misinformed.
was re-recruited last night. Yeah,
I'm not allowed to do any twists and turns, so I pitch while Donovan bats.
Okay. I love it.
I still pitch though, because that's what I do. But yeah, good luck on that cheerleader. Listen, I didn't mean to ignore you today. You ain't got to throw me out like that, bro.
It's all right, man. I do some cheerleading. We're good. We also have Tanya Phillips from Syringe Exchange here today at the health department. So Tanya, any updates you have around either Syringe Exchange or prevention efforts? So please.
Yes. So for Syringe Exchange, we're continuing to operating 3 days a week. Now that we're getting pulled back into our regular public health work, we're able to start working on, again, expanding our Syringe Exchange efforts. And that also includes building back our wraparound services. So that's what always made our program unique, is the number of partners that would come and join us during Syringe Exchange, and then access to HHS services to be able to connect people to care. So we're working on that. I am pulling back our Syringe Exchange committee. So prior to us starting Syringe Exchange services in Jackson County, we pulled together a committee and their purpose is really to help advise us. I'm working on expanding that because we do have other partners in the community that are now providing Syringe Exchange services. And I strongly believe in coordinating those efforts just so that we can benefit the community the best, not, duplication of services. We know that this money isn't always available to us. So how can we make this work the best that we can in Jackson County? And again, this group would help provide some feedback, especially as we were expanding as well. Overdose surveillance. So I did a media interview today with Channel 5. I think last week or the week before that was with Channel 10. Now, again, not COVID all day, every day. So we're getting that back together. We'll be pulling our work group back together, looking to redevelop what our new thresholds were. So far in 2022, we are remaining pretty level with what we saw in 2021. So while that's a lot higher than what we've ever experienced regarding overdoses for non-fatal and fatal related to heroin and or fentanyl, I'm happy to see that it is not increasing those averages. So I'll be able to, I'm also getting back to like our monthly reports. And so I'm happy at these meetings, the ones that I can make, to provide a brief update and just share where we're at with that. And then regarding our prevention programs here at Jackson County Public Health, a long time ago, we used to always provide updates. But our problem, all my staff were pulled into responding to COVID. So we really haven't been able to work on these programs really at all during COVID. So the last 2 years. So it's hard because it feels like we're starting all over, just reorienting ourselves to that work and bringing partners back to the table that have been responding to COVID as well. So it really does feel like we're starting over again. But with problem gambling, one of our major projects is that we want to do is develop a local educational campaign targeting youth, but then also our older adult population. The state often has those materials for us, but we really want something that is unique and specific for Jackson County. So when that time comes, I would love for people on this group to help join us in that effort and make it a real community project, just like what we did when we did our Let's Talk Pot campaign. My alcohol and drug prevention program, that position is open. So if you know of anybody that wants to come work for public health in our prevention world, public health, please let them know. Really want to get that position filled as well. And then our tobacco prevention program, the state is being kind and a little bit less forcing us to do policy work, but a lot more community engagement, which is nice. So I'm hoping that we'll have opportunities for this group to also engage just regarding tobacco prevention as well. So those are really, I think, my updates that I can remember right now.
I feel like you're officially back from able to attend. I shouldn't say that, right? But able
Let's
to.
see. It always depends. I feel like either something in the world of public health happens or staffing shortages, which then pulls me into doing all of that work. So fingers crossed.
Fair enough. It's great to have the updates in the work. So thank you, Tanya. All right. I don't know. I didn't see anybody from Oregon Health Authority here today. And Denise, did you have any information you wanted to share? I have you as a Synergy Health Consulting, but.
No, I don't have anything separate from the SPI.
That's a lot. I mean, I felt like, yeah. All right, cool. All right. Well, thank you on that. No one from OHA. I didn't see Mike Marshall or anyone from Oregon Recovers. Sarah, anything on Oregon Pain Guidance Naloxone Work Group?
You know, I was thinking about this. It's the Oregon Pain Guidance Naloxone Work Group. Well, Oregon Pain Guidance basically doesn't exist anymore. There's a website that's very flushed with professional information, but what has persisted is the Naloxone group, which I think it says a lot. So mostly what happens is people who are very similar to those who gather here come and check in, get support, talk about what's going on with naloxone. But I can tell every month that it's really kind of woven into what agencies and individuals are doing now. It's part of the work that people do. So I think that's probably it. It's just that we're still here and we seem to be doing something right. So.
Well, you have been one of the people, along with Max's missionaries and others, kind of really making sure that our community is kept safer by the prevalence and the accessibility of naloxone. So thank you, Sarah, for the work that you've done with that group. So,
hey, Eric, real quick.
Yeah, Justin.
Have we thought about bringing this back in person yet?
Ooh. Technically, it's hosted by my good friends at Health and Human Services. I would love to get back in person. So I will work with our team and see what the advice is, and we will let everybody in this group know. So
I can tell you that right now. So Jackson County Health and Human Services, we are considered a health agency. So you have to mask when you are in the building. So we still have all of those requirements. And so at this point, I think it would be encouraged to still meet in Zoom just because of those stipulations. So we really haven't brought back a lot of meetings that were hosted here, even by our own agency or partner agencies, just because of those restrictions on us. And we haven't fully even brought back patients yet. We're still working on that as well. But
I do feel like
I can bring it up to see if we can at least have a date.
This meeting should be first in line. When meetings come back, this one, is the one where I'm like, I need to see these people. So all right, Tanya. Well, thanks for
what kind of cookies can you give Jen and I? Then maybe
amazing cookies, really good ones. So yeah. All right. Well, we will continue to work on that and we'll keep people updated. So thanks for that, Justin.
Yeah.
All right. Well, I want to say that how much I appreciate everybody today. There was a lot of information, to echo what Brandon said earlier. It's always inspiring to see the amount of work that gets done in our community and the people who do it. So thank you all for your time today. We will get back a month from now and with another robust agenda and continue to do the good work. So thank you all.